Hello friends, welcome to the channel Dewdear Academy. In this video, I have included the question paper discussion, M.Sc Nursing Entrance 2018 question paper, and it is the part 3 of the question paper discussion. So let me start. The first question. All of the following are important infection control strategies in controlling the spread of MRSA except. All of the following are important infection control strategies in controlling the spread of MRSA except. Options are aggressive hand hygiene, contact isolation of infected or colonized patients, then routine antimicrobial prophylaxis for all hospitalized patients, routine surveillance for nasal colonization among high-risk patients. So here the correct answer here is routine antimicrobial prophylaxis for all hospitalized patients. So here we should know what are the important infection control strategies in controlling the spread of MRSA. So what is MRSA? MRSA means methicillin resistant Staphylococcus aureus. MRSA means methicillin resistant Staphylococcus aureus. There are important components or major components in preventing and controlling MRSA, and that include hand hygiene, then environmental hygiene. Environmental hygiene is important. Environmental hygiene. Then patient isolation, and the patient and staff decolonization. Patient isolation. So these are all the important standard precautions or the important components in prevention and control of MRSA. We know MRSA. This MRSA is an important or serious nosocomial infection. It is a serious nosocomial infection. Serious nosocomial infection in many hospitals. Okay, nosocomial infection. So among the options, here the options given, aggressive hand hygiene, it is an important infection control strategy. Then isolation, patient isolation, that is the contact isolation of the infected or colonized patients is also an important infection control strategy. Then routine antimicrobial prophylaxis for all hospitalized patients, that is not an important infection control strategy in controlling the spread of MRSA. It is not there. Then routine surveillance for nasal colonization among high-risk patients. For the high-risk patients, for the nasal colonization. So for the high-risk patients, for the nasal colonization, the routine surveillance is done. Routine surveillance can be done. Okay, for the high-risk patients, the routine surveillance for the nasal colonization can be done. So that is also an infection control strategy. So the question is, all are the important infection control strategy except the routine antimicrobial prophylaxis. So here this is the correct answer. Correct answer is option C. Okay, correct answer is option C. The next question. Food rich in proteins are called. Food rich in proteins are called. Options: energy yielding foods, bodybuilding foods, protecting foods, and regulating foods. Food rich in proteins are called. Here the correct answer is bodybuilding foods. Food rich in proteins are called bodybuilding foods. Okay, this is the correct answer. Answer is B. So what are energy yielding foods? Energy yielding foods means the foods that is rich in carbohydrate, fat. The food rich in carbohydrate and fat is known as the energy yielding food. Carbohydrate and fat. These are the energy yielding foods. And also protecting foods include mainly the vitamins and minerals. Protecting foods are vitamins and minerals. And the proteins are mainly, the proteins include milk, egg, meat and fish. These are all rich in proteins, and these are the body building foods. Proteins are the body building foods. So here correct answer is option B. The next question, the instrument which follows direct calorimetry is options adiabatic calorimeter, Benedict Roth apparatus, bomb calorimeter, Benedict's oxycalorimeter. The instrument which follows the direct calorimetry. So what is calorimetry? Calorimetry means it determines the energy expenditure. Calorimetry helps in determining the energy expenditure. In direct calorimetry, the heat is measured. And indirect calorimetry, it is we are taking the measurement of oxygen consumption and carbon dioxide production. So here the instrument which follows the direct calorimetry. Direct calorimetry means it measures the body's heat production, and bomb calorimeter is a type of direct calorimetry. Bomb calorimeter is a type of direct calorimetry, and this bomb calorimeter it measures the total energy value of food. So here the correct answer is the instrument which follows the direct calorimetry. The correct answer is option C. Okay, option C is the correct answer. Bomb calorimeter is the correct answer. Then adiabatic calorimetry means it measures the temperature rise as a direct consequence of the experiment. So here the correct answer, the instrument that follows the direct calorimetry is bomb calorimeter. Then the next question, during fever with 1 degree Fahrenheit increase in body temperature, the BMR changes by 7% increase, 7% decrease, 5% increase, 5% decrease. During fever with 1 degree increase in 1 degree Fahrenheit increase in body temperature, the BMR changes by. So here the answer is 7% increase. 7% increase is the answer. The correct answer is 7% increase. Okay, option C is the correct answer. Sorry, option A is the correct answer. That is, during fever with 1 degree increase in 1 degree Fahrenheit increase in body temperature, there is the BMR increases by 7%. And if it is 1 degree Celsius, if it is 1 degree Celsius, okay, 1 degree Celsius body temperature if increasing means the BMR is increasing by 13%. Okay, for increase in 1 degree Celsius, for increase in 1 degree Celsius body temperature, the BMR increases by 13%, and for the increase in 1 degree Fahrenheit, the BMR increases, basal metabolic rate increases by 7%. So please note down this. This is very important. For 1 degree increase in the temperature, the BMR is increasing. 1 degree Celsius increasing the temperature, the BMR is increasing by 13%. And for 1 degree Fahrenheit increasing the temperature, BMR is increasing by 7%. So here the answer is 7% increase. This is the answer, 7% increase. Next question. Okay, what is the recommended dietary allowance of iron according to ICMR 2010 for a 15-year-old girl? For a 15-year-old girl, what is the recommended dietary allowance of iron according to ICMR 2010? Options are 27 milligram per day, 28 milligram per day, 32 milligram per day, 35 milligram per day. According to ICMR 2010, the recommended dietary allowance for 15-year-old girl is 27 milligram per day. Okay, this is the answer, 27. Option A is the answer. Option A, 27 milligram per day. So here we should know what is the recommended dietary allowance of iron. We can say for men it is 17. Okay, for men RDA for iron is 17 milligram per day, 17 milligram per day. And for women, it is 21 milligram per day. For women, it is 21 milligram per day. And for pregnant woman, it is 35 milligram per day. For pregnant woman, this is 35 milligram per day. And for lactating woman, 21, lactating woman, it is 21 milligram per day. Again, for boys and for girls, how much it is? For boys, for 10 to 12 years, boys, it is 21 milligram per day. For 10 to 12 years. Then for 13 to 15 years, it is 32 milligram per day. 32 milligram per day. And for 16 to 18 years, boys, for 16 to 18 years, it is 28 milligram per day. 28 milligram per day. So same way we can see for boys and for girls also. For girls, again 10 to 12 years, it is 27 milligram per day. 10 to 12 years. Again 13 to 15 years, for girls 13 to 15 years, it is 27 milligram per day. And 16 to 18 years, it is 28 milligram per day. 28 milligram per day. So if we know this chart, it is easy to answer this question. Okay, for boys 10 to 12 years, it is 21, and again for girls it is 27. Then for boys 13 to 15 years, it is 32, but for girls 13 to 15 years, it is 27. So our question is this one: for 13 to 15 year or a 15-year-old girl, according to ICMR 10, what is the recommended dietary allowance of iron? Okay, according to ICMR 2010 guidelines, this is the RDA of iron. So with this we can clearly, if you are knowing this chart, you can easily write the answer is 27 milligram per day. Then the next question: urge to attain optimal level of performance on valued task is. Options: affiliation motivation, task motivation, achievement motivation, normative motivation. Urge to attain the optimal level of performance on valued task is. Here the answer is option C, achievement motivation. Answer is option C, achievement motivation. So achievement motivation means it is the drive to pursue and attain the goals. Means that individual with achievement motivation wishes to achieve the objectives. Okay, they wishes to achieve the objectives. Urge to attain the optimal level of performance on valued task is known as achievement motivation. Affiliation motivation means it is the drive to relate to people on a social basis. It is a drive to relate to people, to get affiliated, to get loved by others. That is affiliation motivation. It is the drive to relate to people on a social basis. Then task motivation. Within this task motivation means the individuals must perceive that they are initiating the motivation to undertake the task. Motivation to undertake a particular task is known as the task motivation. And normative motivation means it is the desire to comply with the norms and values. So the achievement motivation means it is the desire or drive to attain the goal or obtain attain the optimal level of performance on a valued task. So here the answer is option C. Then the next question. Forgetting the information because of competition from other learned material is. Options: negative transference, conflict, interference, fatigue. Forgetting the information because of competition from other learned experience. So from these options, it is clear that fatigue is not the answer. Fatigue is not the answer. Then what is negative? Whether it is negative transference, conflict or interference. We know the negative transference. Negative transference means, what is transference? It is part of psychoanalysis. Here the patient react with the transference means patient react with or reaction to the analyst with the feelings held towards childhood and other authority figures. Based on certain feelings, the patient will be reacting to the analyst. Positive, there are two types of transference: positive transference and negative transference. So positive transference means it wants the loving feelings expressed towards the analyst. Loving feelings towards the analyst is known as the positive transference. And the negative transference, the patient is showing a loving feeling, is positive transference, but negative transference means angry, hostile feelings expressed towards the analyst. Angry and hostile feelings that are expressed towards the analyst by the patient, that is negative transference. So this is not the answer. Transference is not the answer here. Then what is conflict? Conflict means it is a dispute between persons, isn't it? We can say it is a dispute. Dispute between persons is known as the conflict. So it is not the answer. Then the answer is interference. Interference is the answer. Interference means people forget information because of the competition from other material. That is coming in memory. Interference theory is there. It means the people forgetting the information because of competition from other materials, other learned materials. That is a memory phenomenon. Okay, interference, it is a memory phenomenon in which some memories interfere with the, memory phenomenon in which some memories interfere with the retrieval of other memories. Okay, as there is a competition from other materials, some memories are interfering with the retrieval of other memories. Okay, that is interference. So here the answer is option C. Option C is the correct answer. Option C. Option C is the answer. The next question. A stimulus that helps one to recall a memory is known as. Options: sign, memory aid, icon, retrieval cue. A stimulus that helps one to recall a memory is known as sign, memory aid, icon, retrieval cue. So here the answer is option D. Option D. Okay, answer is option D. Retrieval cue is the stimulus that helps one to recall a memory. Retrieval cues means they are the stimuli that help a person to retrieve the information from long-term memory. It helps to recall the things that once we were forgotten. The things that were once forgotten that can be recalled with the help of the retrieval cues. Okay, there are many examples for the retrieval cues. It can be done through recalling, recognition, relearning. These are different steps or different ways to retrieve the information. Okay, the information out of your long-term memory storage system. There are different mechanisms to retrieve this information. It can be done by recall, recognition and relearning. So, retrieval cues are the stimuli that help you to retrieve the information from long-term memory. Then memory aid. Then memory aid means they are the devices or the techniques that person use to help them improve their ability to remember something. Okay, they are the devices. Memory aids are some of the devices which they are using to memorize the thing. Example, they are using or some of the techniques. It can be some of the techniques also. Example, we can say using the mnemonics. Using mnemonics to, okay, using mnemonics to learn. That's a technique, or it is a memory aid that help the person to help them improve their ability to remember. So that is memory aid. And then icon means they are the mental pictures of visual stimuli. Okay, that is just an example for the sensory memory. For in case of sensory memory, in case of sensory memory, iconic memory is a type of sensory memory. In case of sensory memory, iconic memory is a type of sensory memory. Iconic memory means mental pictures of visual stimuli, or some kind of icons or snapshots are used. So it is a visual representation. Visual representation is known as the icon. Okay, visual representation or a mental image is known as the icon. And signs means they are the clues indicating something. Okay, clues. Some of the clues are known as the signs. So here the question is the stimulus that helps to one to recall a memory is known as. So here the answer is option D, retrieval cue. Retrieval cues are the stimulus that helps to recall a memory. Then the next question. The defense mechanism where there is unconscious transformation of unacceptable impulses into exactly opposite attitudes, impulses, feelings or behavior is options: repression, reaction formation, introjection, intellectualization. So here the correct answer is option B, reaction formation. Option B, reaction formation is the answer. Reaction formation means expressing the emotions that are the exact opposite of what one feel. Exact opposite of what one feel. That is reaction formation. In example, masking anger. If the person is actually having the feeling of anger but he is masking anger, that is an example of reaction formation. So this is a defense mechanism where there is unconscious. It is an unconscious transformation. Okay, unconscious transformation of unacceptable impulses into exact opposite attitude. So that is reaction formation. Then what is repression? Repression means unconscious blocking of unacceptable thoughts, feelings and impulses. That is repression. Then introjection. Introjection means that is unconsciously incorporating the vicious values, attitudes of others as if they were your own. That is introjection. Introjection means the values and characteristics of other persons are incorporated into your own personality. That is introjection. The values and characteristics of significant persons are incorporated into one's own personality is known as introjection. And intellectualization. Intellectualization is an attempt to avoid expressing the actual emotions, avoiding the expression of actual emotions associated with a stressful situation by using the intellectual process of logic, reasoning, etc. Here we are using the intellectual process of logic, then reasoning. By using these intellectual processes, we are avoiding the expression of the actual emotions and we are expressing or we are using the intellectual process of logic and reasoning. Okay, if there is a stressful situation. So here the exact opposite behavior if we are behaving, and which is also an unconscious transformation, that is known as the reaction formation. So thank you for watching this video. Hope you all like this video. Also watch the other parts of this question paper discussion. So thank you for watching this video.